Let's uncover the truth about liposuction, one of my favorite procedures. So there are many different types of liposuction that you might hear about. Regular liposuction, tumescent liposuction, power-assisted liposuction, ultrasonic liposuction, smart liposuction. These are all slight variations of liposuction, which is basically using a small incision, using a narrow metal tube called a cannula, inserting that tube, using it in a back and forth fashion to suck out fat because fat is quite soft and easily removed in this way. All these different names are attached to liposuction are a slight variation in the technique. For example, tumescent liposuction, all that means is that we're injecting fluid in that area of the body before the actual liposuction is performed. Now, when they first started doing liposuction, it was a very unsafe procedure. They used very large tubes. They didn't use tumescent technique. And what tumescent technique does is that it constricts blood vessels before you take out the fat, which really limits bleeding. And then it also makes the fat removal more gradual so that you have much less risk of indentations and irregularities when you remove the fat from the body. So overall, it's made liposuction a much safer procedure. I always perform tumescent technique, and most plastic surgeons do whenever they do liposuction. It just makes the procedure safer, better, and just an overall better experience for the patient. The other variations I'm going to talk about are ultrasonic liposuction, also called Vaser. And what this does is, before you take out the fat, after you do the tumescent part, the injection of fluid, you place an ultrasound device, an ultrasonic wand, into the fat area to basically break it up and turn it into liquid. Ultrasound is a very fast vibration, and that very fast vibration can break up the fat and melt it before it's removed. Problem with ultrasonic liposuction, in my opinion, is that it's a very old technique. When I was training, and that would have been almost 30 years ago, people were using it in the sense that it was a device that was on its way out. People tried it, some people liked it, some people didn't, but overall it's something that was old and not many surgeons use, mostly because there is a risk of burns. Because that ultrasonic probe or that wand, that device that's inserted into the fat, vibrates at such a high speed, it does generate a lot of heat. And if too much heat is generated, then it will cause an internal burn. And sometimes that burn can be bad enough so that it can burn the skin. And I have seen some really bad cases, unfortunately, of surgeons or other doctors who were not trained to use this device, and it caused some serious burns and some really bad disfigurement. So I think a lot of my colleagues use it, and I respect them, and if you use it correctly and well, you can get great results. But I don't feel that it's the best technology because I feel it is an older technology that's been rebranded with a different name called Vaser, which doesn't really mean anything. It sounds like laser, but it does make the ultrasonic liposuction sound better and newer. And in my opinion, I don't like it, although some surgeons might use it and get very good results. The last kind of liposuction I'm going to talk to you about is laser liposuction, also known as smart liposuction. Other names are around, but smart liposuction is probably the most popular form of laser liposuction. I started doing laser liposuction about 15 years ago now. I was the first person to use it in Hawaii, and this is what I like to use for all of my liposuction cases. Almost all my liposuction, I use a laser, and I use a smart liposuction laser. The reason why I like smart liposuction is because unlike the ultrasonic liposuction device, it cannot cause burns. So there are two things that are built into the device. One is a temperature sensor, so it does not allow the temperature to get beyond a certain point where it would burn a patient. And also the other thing is that it also requires movement to use. Without movement of the laser, you can't use a laser. The laser doesn't turn on, it actually stops. So those two safety mechanisms make the laser liposuction much safer than ultrasonic liposuction, and also much safer than any other laser device that's used for liposuction. The advantages of laser liposuction are two. One is that you are melting the fat before you extract it, similar to ultrasonic liposuction, but it's done in a much more safe manner. And the other interesting benefit of using a laser with liposuction is that I can deliver that laser energy to the skin that causes some heating and it causes some shrinkage and tightening of the skin. This is very similar to all the other energy devices that we use in a non-surgical setting on our Medi-Spa side to try to tighten and lift the skin from the outside. All these devices are placed onto the surface of the skin. The energy that is used, and there are various forms of energy, radio frequency, ultrasound, some use heat. All use heat in a certain way. All essentially heat up the skin internally to cause some sort of shrinkage or tightening. The laser energy that we use during laser liposuction is delivered directly to the undersurface, the inside surface of the skin. So this is a lot more direct. Heat is generated in a very precise yet safe fashion, and that causes some shrinkage of the skin without actually having to cut the skin out, which is very advantageous. These are the two benefits of laser liposuction that make me feel it's ideal for using with liposuction to get patients the best results. Now, the liposuction procedure itself, where the fat is extracted, is the same, no matter what name is attached to the liposuction procedure. It still requires skill, attention to symmetry. You have to be sculpting the body in a way that is going to look the best. You have to be very careful to not remove too much fat or to cause irregularities in the skin by taking the fat out unevenly or too close to the surface of the skin. That's really where the skill of the surgeon really matters to give patients the best results without any complications. These added technologies never do the job for the surgeon. It's still up to the surgeon to remove the fat in the best way possible. These tools just make the procedure better if used properly. So if you're considering liposuction, seek out a qualified, skilled, and caring plastic surgeon for your procedure. If you like this content, please smash up the like button, subscribe to our channel. Next, we're going to talk about scarless breast augmentation. What is it? How is it done? How can it be possible?